Hello, my name is Ravi Vij. I'm from My Cancer Haven, and this is the first in a series of hopefully increasing number of podcasts that we're going to do that is directed towards particular geographies. We're starting off with the Indian context, and we're going to talk about CML from an Indian perspective, and think of no one better to talk to us about this topic than Dr. Pankaj Malhotra, who's professor and head of the clinical hematology and medical oncology department, one of the most respected in India at the postgraduate institute in Chandigarh. And he's been a thought leader in this field, has been someone that people look up to, both patients, trainees, and other physicians. So I'm thrilled to be able to have him on this podcast to talk to us. So, Pankaj, welcome.
Yes, thank you. Thank you, Ravi. Thank you so much for having me here.
So, we're going to talk about CML. And so, first of all, what is chronic myelogenous leukemia?
Uh, so, so chronic myeloid leukemia, the CML is made of three terms. C is chronic, which means there is something which is going on for few weeks to few months, or rarely sometimes in years also. Myeloid means that there are cells in our body, the blood cells, which is there is a myeloid compartment, the myeloid series of cells like neutrophils and myelocytes and those kind of a cells. And leukemia mean a type of a blood cancer. So when you take a full term chronic myeloid leukemia, so that means it's a type of a blood cancer that affects our blood cells, and that kind of a problem is going on for few weeks to few months, and even if it is untreated, it goes on for some duration. So that is what do you mean by a chronic, so chronic myeloid leukemia.
And can you tell us a little more about the disease as to is it a blood cancer, bone marrow cancer? Is it genetic? How is it?
Okay, so it is as such not genetic or inherited. It happens because of the abnormalities which happens in the chromosomes, and you rightly mentioned the Philadelphia chromosome. So Philadelphia chromosomes, we have 23 chromosomes in our body, and there is some exchange of material between the chromosome 9 and 22, and that leads to abnormality in this chromosome. And since it was first discovered in Philadelphia, that is why it is called Philadelphia chromosome. And because of this abnormality, there are some changes in our body. There is release of abnormal tyrosine kinase activity, which leads to increase in the production of white cells, and they keep on going up and up. So it starts from the bone marrow. Obviously, that is our factory where all the blood cells are produced. So it starts from there, and then gradually, that spills over into our blood. So we actually, when we do our blood test, and we can find out if the cells are very high in number. So then we say, okay, there is a possibility of chronic myeloid leukemia.
Who gets it? Who's at risk?
So anybody can get it. Since you mentioned about the Indian perspective, so I may, say here that in India, we have seen the median age of patients who come to us is between 30 to 40 years. And this is opposed to, what you see in US or in the Western countries where the median age is, above 60 years or 55 or 60 years of age. So that means in India, when you diagnose, most of these patients are young, very productive years of life, between 30 to 40 years. You rightly mentioned that it is slightly more common in men. And yes, definitely it is rare in children, but we do have patients, we have kids where we have, diagnosed chronic myeloid leukemia.
How do patients present?
Uh, So most of these patients are kind of asymptomatic. As I said before, it's kind of a chronic form. Uh, In the West, most of the patients are diagnosed on a routine health checkup, but routine health checkups are uncommon in India. So and hence, initially they are all kind of asymptomatic, but as the cells, they increase in size, they will lead to some kind of weakness, fatigue, low grade kind of fever, night sweats. And many times, as the cells go up and up, there is enlargement of the spleen, which is a part in our body, which on the left side of our tummy, so left side of abdomen. So that starts enlarging, and many patients who come to us comes with a problem of heaviness in the left side of the abdomen, or they feel early satiety whenever they are taking food. They say, okay, we are just our stomach is filled up. So that is because of this enlarged spleen which is pressing on the stomach. So these are all the non-specific kind of a symptoms, and these symptoms in India can present in many other illnesses also, especially tuberculosis. So so I would say there is no specific kind of a symptom which is attributed to chronic myeloid leukemia, and hence we always suggest that whenever somebody is having some problem, they should get their routine health checkup done.
How do you diagnose it?
So diagnosis is quite easy now. So the first and foremost is the blood test. We call it as a complete blood cell count, where we look at the white cell counts, which are very high number. The normal white cell counts is between 4 to 11,000 per microliter, but in this kind of a problem, chronic myeloid leukemia, the cells are in thousands and hundred thousands. And many times, we when the if somebody, you start asking the question, and if they say the symptoms are for many going on for few weeks to few months, and if the cells are high, the platelets are normal, so many times we can, and the spleen is enlarged, we say, okay, it's likely to be chronic myeloid leukemia. But the definite diagnosis comes from the genetic testing, which we have discussed before, like checking for a Philadelphia chromosome, or these days it's more common to check for a gene product which is called BCR-ABL. So that can be checked from the blood also, or from the bone marrow also. So here I would like to actually add, many patients ask these questions that, the you can diagnose chronic myeloid leukemia by a simple blood test, CBC, and looking at the BCR-ABL from the blood. Then why do I require a bone marrow examination? And uh, and my answer to that is, so there are different phases of chronic myeloid leukemia: chronic phase and advanced phase. Advanced phase we can divide into accelerated phase or a blast phases. And in India, we have seen that, since there is no routine health checkup, so many patients comes to us at a late stage. And many times from the peripheral blood, we are not able to diagnose whether it is a chronic phase, or it is an accelerated phase or a blast phase. And there is some difference in the treatment as well as in the prognosis, depending upon the phase of the disease. So that's why, a bone marrow test is essential in most of the patients, not for the diagnosis of chronic myeloid leukemia, but for looking at the phases of chronic myeloid leukemia, as well as some of the abnormalities which you can find out only from the bone marrow, like presence of myelofibrosis, the presence of cellular part of it, and sometimes there is a focal collection of blast, which can change the phase of the disease. So we suggest in almost all patients to get a bone marrow test done, as well as genetic testing for BCR-ABL gene.
In the Indian context, do you see patients presenting at a more advanced stage, or is it still mostly in the what we call historically have called the chronic phase?
No, no, this is a very relevant question. So in Indian setting, we see in our OPD close to 40 to 50 new patients of chronic myeloid leukemia in a month.
That's amazing.
And I can tell you about 5 to 7% of patients actually are in advanced phase. So it is still, not uncommon to find the patients in advanced phase of the disease.
But the majority are still chronic phase, early phase.
Yes, majority are still chronic phase. Yes. But we say, when we, uh, say the differences of chronic myeloid leukemia, India versus the West, I would say there are some differences, and I have highlighted those differences in one of my research paper, where I have mentioned that in India, 90% of patients almost has presence of splenomegaly, whereas in the West, it's only 40 to 50%.
Hmm.
The age difference I've already told you about, that in India the median age is between 30 to 40 years, and in the West it is above 55 to 60 years of age. And the blast phase, which is in the West, probably is maybe less than 2% or so, probably. But here it is, close to different series, it is 10%. So in our clinic, it is 5 to 7%, but in most of the other series from India, it is close to 10%, which is, quite high, I would say.
And what else can you tell us about the demographics? How common is it? And in terms of, we'll talk about treatment and access subsequently, but have you got a perspective on how many cases there are in India?
So CML is considered as the most common kind of a leukemia in the adult population of India, and we have published this in a small letter to the editor in Lancet many years ago. And we looked at the different oncology clinics, and the CML is the most common type of diagnosis which you see. And at that time, when we analyzed almost, if I'm getting 100 patients of different types of cancers, 30% of them are chronic myeloid leukemia. So you can imagine that, the kind of commonality of this kind of disease in India. And this is true for all the oncology clinics in India. So we say that CML is the most common kind of leukemia in the adult population. And in the West, it is, chronic lymphocytic leukemia, but in India, it is chronic myeloid leukemia. And as I said before, we see close to 30 to 40 new patients in our clinic every month. And fortunately, now most of these patients are surviving. And currently, if you ask our clinic, we have close to 5,000 to 6,000 patients of chronic myeloid leukemia, getting regular treatment from our clinic. And we run this clinic on our Monday, and we see close to 100 to 120 patients every week who are the follow-up patients. So you can imagine that it is quite common. And because these patients are now surviving and more, so the prevalence has also going up. The number of patients are also going up. Uh, we are also, getting patients now who are getting a routine health checkup. So there is increased awareness, early diagnosis. Somehow in India, in the rural areas, there is still this kind of a thinking that if you are diagnosed with leukemia, there is no treatment. So there is no point in going for any kind of a treatment. So, if this podcast, or, if we can share this information with the other healthcare providers to tell the patients that chronic myeloid leukemia is one which is, these days we call it functionally curable kind of a leukemia. So we are always encourage, and we continue to pass this information that if it is CML, please come to the experts, please come to the any oncologist or hematologist or oncologist, because this can be treated. So it is still a challenge in the rural areas of India.
So, in terms of access to drugs, we know that we have an expanding array of treatment options. How do you approach the treatment for a classic chronic phase CML?
Yeah, so I think this is a remarkable medical advancement which have taken place in the field of chronic myeloid leukemia. And I would actually say not only in chronic myeloid leukemia, in terms of tyrosine kinase inhibitor, this is a new class of drugs which, came in 2000. And now all kind of a tyrosine kinase inhibitors are getting used in lung cancer, kidney cancers, and many other, where the prognosis have really improved. But in chronic myeloid leukemia, definitely this has become a chronic illness. So I belong to an era where we used to use hydroxyurea. Very few patients could afford interferon therapy and transplant, hardly any transplants. So these patients used to survive only for 2 to 3 years. But I'm so happy to, see all these patients who are on tyrosine kinase inhibitor. Wonderful drugs. Uh, Imatinib or Gleevec, it is the most widely used drug in India, and uh, the cost of this medicine is hardly 400 to 600 rupees per month. And even through the Ayushman scheme, which is the flagship of Prime Minister Shri Modi ji, and almost in all centers this medicine is available free of cost. And many times, we tell to the patients, even if they are not able to afford this much amount of money, we have many other NGOs who are helping these patients to get these medicines regularly. We are also fortunate in India that we have a generic version of dasatinib also, nilotinib also, and bosutinib also. So some of the patients who unfortunately develop resistance to imatinib or develop some kind of a intolerance or adverse events to imatinib, we have the drugs like dasatinib and nilotinib. They are a little bit costlier than imatinib, but they're still in the range where most patients can get this. And again, both of these drugs are available through the Ayushman Bharat scheme. So some patients who are in advanced phase of the disease, generally in them, we prefer to give dasatinib or nilotinib. uh, the treatment is lifelong, and I always, so many patients, when I tell to the patients that the treatment is lifelong, so many times, patient asks this question, sir, why, this treatment is lifelong? It is too long a period. And I always share this example with them, and I can share here also. I said, if you develop diabetes or if you develop heart disease, how long are you going to take treatment? They say lifelong. So I said, and are there any precautions to be taken when you have a heart disease or you have a diabetes? They says, sir, lot of precautions which we have to take. So it says in CML, you again have to take lifelong. There are no precautions. You are have a normal healthy lifestyle. So which one is better? Having a diabetes or having a CML? So then most of the patients, they understand, it's better to have a CML than to have, diabetes or, heart disease where still, you can only control, you cannot control the complications. So it's a lifelong treatment, and it's very important to tell to the patient that they have to adhere to the treatment, because adherence is one, especially, after giving treatment for 2 to 3 months, most patients become asymptomatic. They are absolutely feeling normal, and that sometimes is an issue, about the adherence. So you have to, at every visit, you have to ensure that they adhere to the treatment, because that is the only thing which can, keep them healthy.
So, how do you monitor these patients?
So monitoring is a very important component of chronic myeloid leukemia. And fortunately, we have a test which we can do from the blood. We will discuss about this, the BCR-ABL gene product, which is done by a method called PCR, the quantitative PCR, and we can look at the number of transcripts which are present in our body. So uh, we initially, we do the simple CBC, and we have seen that within 6 to 8 weeks, most of the time, the spleen regresses. It becomes normal size. The white cell count become normal in, 4 to 6 weeks, or, up to 3 months of time. But most of the patients, they achieve what we call as a hematological remission, where the white cell counts become normal, the platelet counts become normal, and the spleen regresses. And after that, we start monitoring by this BCR-ABL gene product, which initially we do every 3 monthly, and then in India we do 6 monthly, because this test is, costlier than the actual cost of medicine. So the medicine costs 400 to 600 rupees a month. This test cost approximately 3,000 rupees a month. But it is very important to monitor these patients, because that can tell us what is happening to your chronic myeloid leukemia, at a genetic level.
And you sort of touched upon this issue about the financial support and affordability. Is there much you would like to add? I know you yourself work to produce content in this area, so would love to have your thoughts.
So, yes, there are different. So, one is to, through the Ayushman Bharat, but there are many health schemes by the state governments also where imatinib is provided free of cost to many of these patients. In fact, even the travel also is provided free of cost to these patients, coming from the hometown to the institute, whether you travel by transport bus or by a train. So that is almost free of cost to these patients. They need to get a signature from the doctor. So, and besides that, there are many NGOs who provide, they are very happily, provide this medicine, because all the NGOs are looking at a disease which is kind of a treatable or curable. So, and the cost is not very high. So, I think almost all patients, even if they don't have any kind of a money, they get this medicine free of cost. Besides that, there is a support from the GPAP, which is Gleevec International Patient Assistance Program. It's actually, you know, they started in 2002 or three, and they provided the medicine Gleevec free of cost to close to 20,000 patients in India, and they still are providing to this medicine free of cost to around 16,000 to 17,000 patients in India, but they have stopped enrolling new patients because the medicine as such is available through Ayushman Bharat and is quite easy to afford now. But they have a support group which is called Friends of Max. Uh, Friends of Max is a support group where any patient who is not able to afford the monitoring therapy like BCR-ABL, so they help in getting the BCR-ABL done. They also have produced a booklet, and I have, I was fortunate to make frequently asked questions in that booklet, and it is available free of cost on their websites of Max Foundation as well as Friends of Max. Where we have discussed all these frequently asked questions by the patients, and the so and internationally also there are a lot of support group for the CML patients.
And uh, one of the questions that patients always have is, what can I do to make sure that I'm doing the best for this disease, other than from, drugs? What is your answer to them?
So one other difference in the West versus in India is that here when they are diagnosed with cancer, it is still considered a very kind of a dreaded word, and most of the patients they get segregated from their family members. So we always ensure, we tell them that this is not contagious, they can stay with their family members, it is not transmitted through from one person to the other person. The husband and wife can stay together, and the good thing about CML is that they can have a normal diet. I always ask them that they can have anything except tobacco or smoking, and uh, and alcohol. So alcohol, smoking, and I always ask them to avoid, and I ask them to to be they are kind of a healthy, and they do all kind of things. Whatever job they are doing, they can continue to do that kind of a job. If they are, most of the Indian ladies are kind of a housewives, at least in the rural area, so they can continue to do their work. And if they are, working women, they can also continue to do that. The men also, they can continue to do their normal activities or travel or attend all the social functions, the marriage functions or whatever. So we generally ask them that they just make sure that they are taking the medicines regularly and they are getting a regular checkup. Otherwise, they are just like a normal person.
So I think you have touched upon some of the misconceptions and misunderstandings. Is there anything you would like to highlight that you've not already touched upon?
Yeah, so again, in India, it's quite common that whenever they are diagnosed with this kind of a disease, they sometimes switch to alternative system of medicine. So we tell them specifically uh, that we have a medicine which can control and you can have a normal lifestyle, a normal life. So please don't stop this medicine and switch to any alternative system of medicine. So that we ensure from the from the first consult, and we just tell them they just have to come every 4 to 6 monthly to the clinic, and get a regular test done, and we just ensure them and tell them that they have a normal kind of a life. uh, so yeah.
So, what would you want the audience to take away from this discussion?
So whenever a CML is diagnosed, as I said before, in India, it's a kind of a taboo. It's kind of a considered as a dreaded disease. So the most important thing is when we diagnose them, we give them this information. We tell them that this is treatable, and actually, I tell them, if they are taking these medicines regularly, getting their health checkup done regularly, in some patients we can possibly cure also, even though it's still kind of a lifelong health checkup. So they have to be very regular with the medicines. The medicines should be part of their routine life, like in the morning when they get up, they do the brushing of the teeth, they take a bath, they take a breakfast. So they have to take the medicine, so they have to ensure that medicine is part of their daily lifestyle, and this just one tablet of medicine which they can take after meals, or they fix up the time and they just take these medicines regularly. And because that is the only thing which can keep their leukemia under control and their normal life. And in case if they have any kind of help which is required, they can always ask for the support. Uh, and generally, in my clinic, we diagnose around 40 patients a month. So in each clinic, we have 7 to 8 patients. So in India, we take the permission and we ask them to be together. And we do this kind of a counseling for all the patients together after their consent. If they agree that, yes, we can share this information. So we give this information and we kind of make a group where, they talk to each other. They talk to each other and they know, we have all kind of patients from from the kids to the adults, mostly adult, and they get reassured that we are not alone in this journey and there are many other patients. So that kind of really help them. So we just tell them that this is a leukemia which is kind of a treatable, and it is better to have this kind of a illness than to have any other kind of a heart failure disease or heart disease or diabetes with complications.
So, you're obviously
You're
doing
obviously doing.
premier work in this area. India is a large country. A lot of people can't make it up to Chandigarh. Could you give us a few? There are hundreds, obviously, of institutions in that country that do great work. But can you point to a few that are doing some pioneering work in this area? And what are the resources? Patients are on social media these days. Any tips you have for patients?
So one thing which I would suggest to patients is that they should consult a hematologist or an oncologist. They can follow up with their family physician later on. But in India, it's still common that sometimes they go to their family physician who knows about that there is a drug called imatinib. So they start the patient on imatinib, and but they don't monitor these patients. And many times, we feel in our experience, we have seen that if the monitoring is not done and if the patient goes into an advanced phase of disease and then these patients are referred to us, then we really feel very pain. The disease which is kind of a treatable has gone into an advanced phase where it is more difficult to treat the patient. So I would urge through this podcast that patients who are diagnosed with chronic myeloid leukemia, at least they should consult a hemat-oncologist or oncologist. And these days, we are fortunate that we have these specialists all over India, and not only in all the bigger cities. Bigger cities, obviously, you have mentioned about Mumbai, Delhi, Kolkata, Vellore, Bangalore. But we have now in tier two cities also. So they should consult a hematologist and oncologist, uh, and then they can, follow up regularly with their family physician also. There is a patient support group also. So various kind of resources are available. Uh, so, they can all avail of all these opportunities.
And before we wrap up, I guess, what are your parting thoughts? Where do you see CML treatment going as far as the Indian context goes in the big picture? And what other tips or messages that you've not already had conveyed that you would like to put out there?
So the only thing which I would suggest uh, to the to not only the patients, I actually suggest to all people is that if they can ensure their regular checkups, health checkups once a year, and I always say, they can have their health checkup on their birthday, one day before their birthdays or one day after their birthdays. Simple routine testing of the blood test, CBCs, and the sugars, and the blood pressure checkup. So that actually really helps not only, in diagnosing these illnesses, but many other illnesses also. So that is still, uncommon as compared to as the routine health checkup. So that I would like to pass this message. And CML, if diagnosed in the early stage, is, as I said before, is kind of a becoming curable. And in future, we are going to see more and more patients where we can possibly stop the medicine. Although I still say that they would require a health checkup regularly, even if we are able to stop the medicine. And the future work is, actually focusing on this part of the aspect only, that who are the patients where we can really stop the medicine and where the disease does not come back. Uh, and rest of the things we have already discussed, I would say that, it is still better to have this kind of a leukemia than many other leukemias, although nobody wants to have any illness, but, it is still one of that disease where we have a lot of treatments which are available, but a strict health checkup, strict follow-up, and a regular intake of medicines are essential to keep this disease under check. Thank you.
Well, I really want to thank you so much for that very detailed discussion. Hopefully, we can have you back for a future podcast on this and other topics. We'd love to get your insight that is invaluable. Uh, Thank you for everything you're doing, and I really want to thank you for giving us your time today.
Thank you so much. Thank you so much for having me here.